asking the patient at first to close his eyes, and then we ask him to tell what he is hearing in each ear. We can also do the so-called Whipper test and Rene test. These tests are called tuning fork tests. Tuning fork tests are done only if there is diminution of hearing in one or both ears to differentiate between the so-called conductive deafness and nerve deafness. Rene test is done as follows. We ask the patient to hear the vibration of the tuning fork both on the mastoid process. We compare the vibration of the tuning fork over the mastoid process, and we compare bone conduction and air conduction by asking the patient to compare between vibrations with the tuning fork both over the mastoid process and with the tuning fork both in front of his ear. Usually air conduction is better than bone conduction. If the reverse occurs, that is to say if bone conduction is better than air conduction, we can say that the patient has conductive deafness. Weber's test, on the other hand, is done by putting the tuning fork, the vibrating tuning fork, on the midline, on the forehead, or on the vertex, and ask the patient if there is any lateralization of vibrations to one of the ears. In cases of conductive deafness, lateralization of the sound occurs towards the diseased ear, whereas in cases of nerve deafness, lateralization of sound occurs towards the healthy ear. Examination of the vestibular branch of the eighth nerve is not routinely done, but is only done in certain cases suspected of having vestibular damage. Vestibular functions are examined by the so-called rotational test, which is done on a rotatory chair, or by the so-called caloric test by irrigation of the ear with a cold water or a warm water. However, we do not routinely examine vestibular functions. Then we proceed to examination of the glossopharyngeal and vagus nerves. Examination of the glossopharyngeal and vagus nerves are done as follows. We ask the patient to open his mouth and to say ah, and we notice the movement of the palate and the position of the uvula. We notice the movement of the palate bilateral on both sides, and we notice that the uvula should be central in normal cases. We proceed then to doing the so-called gag reflex, by using a tongue depressor and touching the palate or the posterior pharyngeal wall, and notice the gag response of the patient. Then we proceed to examination of the 11th cranial nerve, which is the accessory nerve, by testing the power of contraction of the sternomastoid muscle by asking the patient to push towards one side and examine and palpating the opposite sternomastoid muscle. And we repeat the test with the other sternomastoid. Then we test the trapezius muscle by asking the patient to shrug his shoulders against resistance and observe the bulk of the trapezius muscles and the power of their contraction. Then we proceed to examination of the 12th cranial nerve, which is the hypoglossal nerve, as follows. We ask the patient to protrude his tongue, and we notice any deviation of the tongue towards either side. Then we ask him to move the tongue from one side to other to test his ability to move the tongue. Then we ask him to push with the tongue upon the inner aspect of his cheek with his mouth closed, and to repeat the test on the opposite side to test the power of the tongue muscles bilaterally. Then we have to inspect the tongue for evidence of fasciculations or wasting. We have finished with examination of the cranial nerves. We are going to demonstrate now examination of the motor system. Examination of the motor system should include the following items. We should examine the muscle status, the muscle tonus, the muscle power, and we should inspect for evidence of involuntary movements. Then we examine the reflexes. We start by examination of the muscle status and whether there is deformities or not. Examination of muscle status is done by inspection for evidence of muscle wasting or hypertrophy. We should inspect the four extremities for evidence of wasting or hypertrophy. Here, no apparent wasting or hypertrophy of the muscles of the extremities. Also, no apparent deformities of the extremities. The second item in examination of the motor system is testing for muscle tone. We examine the muscle tone at the wrist joint by passive shaking of the wrist like this. Then we proceed to examination of the muscle tone at the elbow. This is tested by passive flexion and extension of the elbow joint, and we repeat the test on the other side. Examination of the muscle tone at the shoulder is done by the so-called Gower's test. Gower's test is done as follows. We raise the patient's shoulders by our hands put in the axillary fossa and raise the shoulders this way, and we notice the muscle tone. If there is hypotonia at the shoulder, we notice the so-called telescoping of the patient, where the shoulders are raised up while the body drops down in a telescopic manner. Then we shift to examination of muscle tone in the lower limbs. Examination of muscle tone at the ankle is done by passive shaking of the ankle like this, and we repeat the test on the opposite side. Examination of muscle tone at the knee is done by passive flexion and extension at the knee joints, whereas muscle tone at the hip is tested by two main methods. We can examine muscle tone at the hip by passive raising of the extended lower limb this way and leave it to drop on the couch, and we repeat the test on the other side, and we repeat the test on the other side this way. If there is hypertonia at the hip joint, the lower limb will fall as a pillar on the couch, whereas if there is hypotonia at the hip, the lower limb will be flexed at the knee and externally rotated. The other method of testing muscle tone at the hip is done as follows: by flexion of the hip and knee joints this way, and flexion of the hip and knee joints on the opposite side, and we leave the limbs, the lower limbs. If the patient has hypotonia, the lower limbs take the frog position, that's to say external rotation of the lower limbs occurs. Whereas if the patient has hypertonia at the hip joint, both lower limbs are kept close together if left in this position. We proceed then to examination of the muscle power. Examination of the muscle power is done as follows. We start by hand grip. We test hand grip